Good afternoon. And today we have pleasure of interviewing my friend and supporter and neighbor, Dr. Sari Schwartz. She has in a very unique field, behavioral optometrist. Good afternoon, Sari.
Hello, thank you for having me today.
And first of all, thank you to our sponsors. You see that above the interview, NeuroBalance, that technology would help people to fall asleep or fight insomnia and anxiety without medication, just using this band. You can use the band 30 minutes before sleep, and with the waves, what will stimulate your vestibular nerve, it's going to put you kind of in that rocky boat state, and then you fall asleep without medications. Great technology. And thank you very much to our listeners. If you have trouble sleeping or sleep next to snoring partner, this program going to be very interesting for you, because we're going to look through the lens of vision. And if you're a medical practitioner who passionate, just like us, to connect all the dots of disease of the modern type or sleep and breathing disorders, or what we can do to improve the life of our patients, this program is going to be for you. And I would like to introduce Dr. Sari Schwartz. I'm so honored what we were introduced to each other actually through physical therapist who was also on my channel, Dr. Neil Halligan, and he was looking for the same type of specialist like Sari in New Jersey, because behavioral optometrists can do a lot for tension in the body by optimizing the vision, for grinding and clenching. That's one of my favorite topics, to create the balance. And not that many people know about that. And especially that's important for people who have a little trouble with balance, because our eyes play such a significant role in that balance mechanism. And, and vice versa. If they're not reunited, then it can take you off the balance, and those detrimental falls can happen, and they can really put your life on pause. So I'm going to do a little introduction of Dr. Schwartz's accolade. She has a degree in behavioral optometry. She has a practice in Milburn, New Jersey. And if you find the topic of today's conversation can be applied and help you to stay in balance better, please find her information underneath this interview. And she's also did a lot of volunteering work for people who don't have such access in the care, volunteer work in Mississippi, Arkansas, Tennessee, to provide care to underserved community. And she's just a great specialist, and she unpuzzled this complicated topic, and today we'll find out what behavioral optometry can do. So my first question to you, many patients with balance also show subtle visual dysfunction, and how visual therapy, I'm talking about therapy, can retrain. Just like we want to retrain the tongue, we want to retrain the eyes to communicate more effectively with vestibular and proprioception system, with the system what important for the balance, and reduce body tension, what a lot of patients who I meet in my practice experience. Please introduce us.
Thank you so much. Well, thank you for the lovely introduction. It is such a pleasure to be here and be collaborating and making sure that we have a team approach to helping others and working together, because so much of what we do and work on together involves retraining the brain, and that happens from multiple different standpoints. And so putting our team of professionals together to work together and best see our patients as a whole is always the end goal. So thank you so much. It is an honor to be here, and I'm excited. I love to talk about what I do. I think that a lot of what I do isn't necessarily understood. And so today I very much appreciate the platform and opportunity to get to hopefully explain and educate others on what it means to be a behavioral or a functional optometrist, and how we take that into consideration when treating our patients. So typically when we have our standard eye exam, we're looking for two main things. Are our eyes healthy, and can we read the small letters on the small chart far away? And those are both very important measurements to make sure that we have those up to date. But we obviously don't walk around reading those small letters on the small chart far away. You have so many other visual skills that have to be taken into consideration to succeed in that environment. And because 80% of the information somebody is taking in is through their visual system, your visual system can significantly impact everything else. And so when it comes to our eyes and retraining the brain, we have to be able to focus and team and move our eyes, because we don't actually see with our eyes. Our eyes are just these receptors. They receive a signal and they send that signal to the brain. And so really what we're both going to be talking about today is retraining and enhancing those neural pathways between for me specifically, the eye and the brain back to the eye. And I'm excited for that today. Thank you.
I'm going to ask you the question, which is very personal. Several years ago, my father lost the vision on one eye. It was terrible, but, he had another eye and, he's functioning fine. But what happened with his body? It's completely shifted.
Yeah.
When I try to explain that's the vision, but, he doesn't have those knowledge, and, he functions as he functions, but his body is completely misaligned. So, of course, knowing you, I see how body compensate. But tell me about those compensations.
Absolutely.
What they hidden in the neck tension and shoulders and even the hips.
Yes. So first of all, I'm so sorry to hear about your dad. I can very much relate and empathize. But when it comes to your body and your posture, let's say, like, for example, in what we're talking about here, if we completely occlude or we get rid of one eye, that's going to significantly change how we're taking in information, specifically related to our depth perception, our ability to judge where we are in space in relation to other objects, but also where other objects are in relation to other objects. And therefore, things like navigating space become very different and much more challenging. The other thing is that if you think of your visual system, sometimes we see patients who have an eye patch, or in this case, they've lost an eye, or maybe it's a kid who is doing a homework assignment and their head is down on their table, or they're changing their eye posture, or it's a kid who's standing with their hand on their hip and their head is tilted, right? We've all seen these different postures or adaptations, and I like to think of this in kind of two examples. The first is a tripod. Okay, so if you think about a camera that sits on a tripod, that camera is sitting on that tripod so it can take the clearest, best picture possible. And if you think about your body or your legs as your bipod, if you will, and your eyes as your camera, if your body and your legs are moving all around, you're setting your eyes up or your visual system up to take a blurry picture. So it makes it more difficult for you. So I always remind my patients that, hey, nobody has perfect posture, but I do expect you to be aware of how your posture may or may not be setting your visual system up for success and therefore your other systems, right? The second is if you think of your body as three upside down triangles. So we have our head triangle, we have our torso triangle, and our lower hip triangle. They all stack on top of each other, right? Which means that if your lower triangle is tilted, because let's say we're a kid standing with our hand on our hip and our lower triangle now is slightly tilted, that means that your middle torso triangle will have to compensate in the opposite direction to be able to give your visual system the opportunity of being able to have a level or an even playing field in taking in information. So your body plays a huge, huge factor in this. And as you're navigating through space, the information around you might not be moving, but it might appear to be moving. A concept called optic flow, where as you're navigating, other things are passing by you in the opposite direction, even though those things are not moving. And so when we have a difficult time setting our visual system up for success, either because we've lost an eye or we have a difficult time using the two eyes together, it makes this concept of using our body and taking in the information to be significantly at a disadvantage or more challenging. And so it's always important to do whatever we can to set ourselves up for success in any realm, right? And I think everybody defines success differently as a personal preference and a professional preference, right? And when it comes to your visual system, I define success as your eyes aren't holding you back from anything you want to be able to do. Yeah, you have clear vision, but you have comfortable single vision. Your eyes aren't causing headaches. You're able to drive appropriately and not worry about hitting the car in front of you, right? So we look a lot at how your body sets your visual system up for success so you can best take in the information around you.
I have a question for people who don't know exactly. We already understand what behavioral optometrists set our system for success. But I want to know what instruments you use to do that training and how you exactly do to make sure that both eyes, see in the same time,
Yes, I love this question. So first of all, of course, every patient is different. So what's successful with one patient might be slightly different with another. But through our individualized therapy program for each patient, we're able to customize specific instruments to best help them. So for example, if I have a patient where I know one eye is significantly more dominant than the other, and I know that other eye is at a disadvantage or not seeing as clearly, I can therefore blur the input to the dominant eye to force the weaker eye to have to function. And that way, when the brain starts to receive the information from the weaker eye, that signal strength is building. And therefore, the brain will move from a concept called binocular rivalry, difficulty putting the two eyes together, to binocular summation, being able to use those two eyes together. So ultimately, when we're controlling the input, we can do that by blurring one eye and forcing the weaker eye, but I can also do it on a smaller scale where, let's say, both eyes are seeing equally, and now I want to make sure the brain is summating or putting that information together. I can use different filters like red-green glasses, where one eye receives one image and the other eye sees another. In order to complete the whole picture, the brain has to be receiving the signal from both eyes. We also do a lot with different prisms and filters and lenses as a tool for binocularity. We can use plus lenses and minus lenses and prisms in a lot of different forms. And, when I think of prism, I think of the Pink Floyd album cover, Dark Side of the Moon, right? It has that classic triangle that looks to be fairly clear, and light comes in and it bends the light and it scatters like a rainbow. So essentially what prism does is it redirects light. And when a prism redirects light, it can shift an image, and we can use that as a therapeutic tool to help our patients build their ability to use their eyes to cross together and uncross together, because that will allow them to use both eyes pointed at the same place in space and ultimately help them further develop their binocularity and depth perception.
But I'm wondering, for people who have one eye, as my father, what you do for them?
That's a great question. So we would work on, of course, strengthening the monocular skills. So for instance, I can have my patient read the small letters on the small chart like you would in your standard eye exam. But since that's not necessarily realistic of everyday life, we can do things like help them with what's called monocular cues to depth, which means that it's more challenging to understand depth, but even with one eye, you can still understand it. So for instance, you have concepts like relative size, magnitude. So if I'm a relative distance as well, you know that if I'm bigger, I'm close to you and if I'm further. So we have different training techniques for that. We also would really want to work on our ocular motor skills for that eye to make sure that eye is moving efficiently. They're able to fixate on that target and stay fixating, looking at it, but also able to follow a target as it's moving and jump from one target to the next, and building those skills to have them better be able to accurately identify size and distance changes.
But it's a lot of homework in your training, or how does it work? Or somebody have to wear the specific lens from one appointment to another appointment, and then you reevaluate?
So, of course, every patient is different, but what we do in our therapy programs is we create an individualized approach where each patient may or may not have lenses depending on what their needs are. But we typically would use some sort of lenses to help them, whether it's to facilitate switching back and forth between different viewing distances or sustain near vision comfort. And at that time, we're really able to individualize their program for when they come see us, which would be once a week for about a 40-minute session. We would work on 4 or 5 different exercises, similar to some of the ones I've explained. And then we would send home some exercises for them to re-enhance and strengthen those neural connections and those pathways that are there that we're looking to make stronger. And so the home practice program is typically 15 to 20 minutes a day, 5 times a week, where we're working on the exercises that we've done in session and we're leveling up on them in between. And when I say leveling up, I mean loading the demand. So I can have you read those small letters on the chart or switch back and forth with an eye patch to a metronome, right? We're adding in all these different layers to allow for automaticity or fluency, ultimately striving for multi-parallel processing information, which just simply means doing more than one thing at the same time. So for instance, when we first learned to drive, we're not answering the phone, we're not yelling at the kids in the back, right? We're focused on getting from point A to point B, and it's taking all of our attention and energy. And now we're probably at the point where we can get home from our workday and say, what just happened? How did I get here? That was so fast, right? That process of driving has become so fluent or automatic for us that we're no longer needing to think about turning on our blinker. It just happens. And so we're multi-parallel processing that information, and now we can listen to the radio or have a conversation. And so the goal when it comes to our visual system is to get us so we're able to automatically focus, team, and move our eyes to process the information. That way our brain power isn't going toward those visual skills, it's going toward learning or whatever the task is at hand.
This is beautiful. Now I want to talk about this neurobalance technology. I'm very passionate about retraining the brain, or you use different remedies for insomnia and anxiety as a stimulating natural brain rhythm. So thank you very much to our sponsors offering that technology. But vision therapy also work by retraining brain without medication. And how do you see this kind of drug-free approaches, whether through visual correction or posture work or neuromodulation, as a future of the patient care, which hopefully with our podcast and it's evoked the curiosity and people are gonna start looking at this different. So what would be your prognosis for the future?
Sure. So I think that medication is an important tool when used appropriately and when necessary. I also feel that very often there are alternative solutions or more conservative measures that we can try in order to avoid medication. And so when it comes to your eyes and how we're taking in the information, very often we'll hear a mutual diagnosis of something like ADHD with our patients, right? And so ADHD is diagnosed based off of a symptom checklist, the DSM-5. And what this is the parents will go through and simply check off what they feel applies to their child. And if they meet a certain amount of criteria, then they'll receive a diagnosis of ADHD. And a lot of times those patients are then medicated and some of their symptoms are improved, but a lot of their symptoms don't necessarily resolve. And so what we're seeing is that maybe we might actually be treating the symptoms or the behavior of something as opposed to the underlying challenge. And if you look at a learning related vision problem checklist, symptom checklist, and you compare that to the ADHD DSM-5 checklist, there's over 90% overlap. And so I think that ADHD is a real condition. I think that there are definitely patients who do need medication, but I also feel that there are a lot of patients who might be over medicated or might not have a true diagnosis in this example of ADHD because maybe they have an underlying learning related vision problem that's causing symptoms and behaviors such as avoidance, and therefore we're seeing what appears to be ADHD. And then when we are able to treat the learning related vision problem, we see those ADHD symptoms evaporate. And we know a neurologic condition doesn't just disappear. And so that to me shows me that if I can get to the root of the problem, then I'm able to change that person's life as opposed to masking what's going on. And a silly example of this would be taking Tylenol, right? How quick are we as a whole sometimes all guilty of taking Tylenol if we have a fever, right? Okay, great. So we got rid of having a fever, but what's causing the fever? That probably could be an underlying infection. And why isn't that something that's being addressed? And so I feel that medication can be a useful tool when used appropriately, but I also feel that getting to the root of the underlying challenge is so important so that you're not just continuing to address the symptoms.
No, this is so beautiful, as you said, and it's so related to philosophy of our sponsors, neurobalance, but they're trying to, to get to the root cause of the problem. And I want to mention, my personal interest towards behavioral optometry because of the Bruxism and grinding and body tension very often might be the vision. And as I mentioned to our previous conversation, now I ask people who come to me with temporomandibular joint disorder with the pain in the joint, what's the story with the vision? And I find this wonderful universal answer called astigmatism. And then it's kind of proof me, the right to say to the patient, you're doing that because you're searching for your balance. But the eyes, the visual system might be the source of disbalance. How, two eyes take the signal in. Mm-hmm. And then people do this.
Yes, we see that a lot, I think, in our mutually respective fields, that a lot of my patients have a very tight or closed visual system where they're either tunneling and lacking peripheral awareness and their visual system is very tight, or they have a tendency to over-focus their eyes. And there's a muscle inside the eye that's adjusting all the time. When you're looking up close, it's clenching. And when you're looking far away, it's relaxing. And that shift or switch back and forth can be very challenging if when you go to look up close, you don't know how to appropriately focus that muscle. So for instance, let's say we're going to look up close and read a book for 10 minutes. Okay. We know it can be at least an hour, but we're going to call it 10 minutes of looking up close. That means that the muscle inside your eye is squeezing for 10 minutes. And if you are over squeezing or white knuckling because you're trying to sustain keeping things clear up close, and now it's time to go to look far away in the distance, if you've been white knuckling or squeezing as tight as you can, it makes it difficult to fully relax when you go to look in the distance. And then you go to focus again and that muscle's so tired, it's like, no way, I can't play this game. Okay. And so we see our patients have a lot of tension in their accommodative or their eye focusing system. And then that can significantly impact their eye teaming system because your focusing and your teaming are very closely linked. So generally, if you have an issue with one, you're probably going to have an issue with the other. And oftentimes for our patients who are very strong or over focus up close, they might even have an eye that turns or kicks in up close. And so through therapy and with different lenses, including either generally low plus lenses or prism as well, we can help train the visual system to relax. And then we use these tools as almost like a band-aid or a step in the right direction until we're able to teach the underlying skill. And then they no longer hopefully need those tools because they're able to learn the skill.
Yeah, but tell me, just for my personal curiosity, does ever patients who come to you with those problems complain on the tension in the neck and the shoulders and in the jaw?
Absolutely. So a lot of our patients who have such a tight visual system and are very tunneled in and have a tendency to sometimes hold things almost closer than you would expect, right? You can definitely see how when they're pulling in their visual system, everything tightens up around them. And so we try to start with the visual system, but that usually is a step in the right direction in terms of the eyes, but it might not loosen up the whole body, which is where I need you.
Thank you very much. That was great. We really appreciate our sponsor, NeuroBalance.
Yeah.
And we appreciate you, Dr. Sari Schwartz. And please find Dr. Sari Schwartz in her office in Melbourne. And she has a wonderful website, Dr. Sari Schwartz.
It's Vision Development Center.
Vision Development Center of New Jersey. And we're going to have that information underneath the interview. So thank you very much.
Thank you. Thank you so much. It was a pleasure.
Yes, I hope we're now going to see all clear and coordinated and balanced.
Exactly.
Thank you.